What's up, yo? It's a wonderful afternoon, Friday afternoon, and welcome to the Real Talk Show. It's me, your host, Malungo Manga. And as you all remember, yesterday, the 12th of December 2024, we were commemorating the Universal Health Coverage Day. And so that's going to be our main topic of today's show. And for me to discuss that, I am joined by two amazing guests. The first one, who is Brenda. And Brenda, I'll need you to explain this to me. Brenda is an AFNHI youth cohort mentee. And I'm also joined by Josh, who is an AFN. Guys, you guys really have to explain this to me as well. He is also a cohort mentee. Welcome to the show, guys.
Thank you. Thank you.
Thank you
Okay, we are
very
so
much.
glad
So my name,
we are so glad to have you here as the youth platform. So Brenda, could you just tell us a little bit about yourself and please explain the AF cohort mentee to us?
thank you, Malungo. My name is Brenda Bonarelli. I'm a policy and advocacy officer at Working Health. I'm also an AFHNI cohort mentee for 2024. So AFNI is the Africa Free of New HIV Infections. It's a network of uh, African advocates for HIV prevention. And so they seek to make this process of fighting HIV more localized and more specific to the continent. So, as part of the strategy to build future advocates for the next generation and to create the interest of the youth in HIV prevention, that's why they came up with the AFNI Mentee cohorts, which we get to be equipped with skills on how to be good advocates. For me personally, it was the entry points that I had into the health advocacy space. I've just gotten
Yeah.
into this space and it gave me 10 steps ahead because now I feel like I'm ready to become an advocate. I already am, I believe. Yeah, thank you.
You already are actually. All
Yeah.
right, that's really nice. It's safe to believe that Kenya is definitely safe hands. After this description, just given, it's definitely safe hands. Hi, Josh. Are you with us?
Yes, Malungo. I'm good.
Okay, so could you just tell us a little bit
Yeah.
about yourself, also what you're doing as the youth cohort mentee? I don't want to mention those abbreviations yet. Let me get a hang of them first.
Yeah, definitely. I think Brenda
Yeah.
has touched a lot on what AFNI is, and it's an exciting opportunity to not only network with fellow African advocates, but it's also an amazing opportunity to learn and
Yeah.
acquire skills on how to lead the fight against ending the spread of HIV. And it has been very, very useful to me. I am not only grateful for the opportunity to be selected into this cohort, but very appreciative of the opportunity as I'm a social work student in Zimbabwe, and these are all skills that I think are very paramount in my own development as a professional and as a future. I'm actually an advocate right now, and as an advocate
Ah,
right now, so yeah.
okay, nice. So we have Kenya in Zimbabwe. This is gonna get exciting. Yeah, so since the main topic of today is universal health coverage, so I'll start with Kenya. I'll start with Brenda. Brenda, could you just tell us a little bit about the current state of healthcare in Kenya and why universal health coverage is such an important issue?
Okay, thank you for that opportunity. So in Kenya right now, first I can just define what UHC is. So it's universal health coverage. It seeks to ensure people have access to quality and effective health care without
Yeah,
facing financial hardship whenever and wherever they are. So currently in Kenya, we have the Kenya Primary Healthcare Strategic Framework that was running from 2019 to 2024, which placed primary healthcare as the strategic tool, as the main driver to achieving UHC as a country. So currently with the state of UHC, so under primary healthcare, we get to have different services. We have access to services like maternal healthcare and child health, immunization, family planning, HIV
yeah,
prevention, and other general treatment of other diseases. So a main driver of primary health care, we have the community health, and that's like the hot cake right now in the country. It's the major thing. So community
Yeah.
health services, our community health program, we have community health centers in the different places. It seeks to ensure health gets to the people at the grassroots levels, the people in the villages, deep where we can't really get to. So with the community health program, we have a community health center that serves people within a geographical location of around 5,000 people. Then each community health center has 10 community health promoters. So these are people from these communities who undergo training and then they go back to the communities to offer different services. Then we have a community health assistant who supervises the promoters. So maybe I can just quickly touch on what the community health promoters do, because
Yeah.
they're the they're the real MVPs right now. So
Yeah.
they visit the households to check people's status when it comes to health. So looking for any signs of danger, sickness. You know, when people get things like TB and they're unnoticed, the whole family can easily be compromised. So they go into the households. If they find a case that needs to be referred to the community health centers, they do the referrals. They also create demand for the health services that are available. You know, sometimes we have the services, but people don't
Yeah.
know the services that they can access from the government facilities. So the promoters actually create the demand for the services that are available. They also ensure that they offer health knowledge. They ensure that people are equipped with information and they act as a link between the community health centers and the individuals. Yeah.
You know what I love about that? I love the fact that you people are coming from this wide group of people and you are
Mm-hmm.
narrowing down to meet the least person. Hence,
Oh,
you're
yeah.
covering universal health coverage right there. I like that. I like that.
Mm-hmm.
Josh,
Yeah.
could you also just briefly tell us what the current state is there in Zimbabwe about UHC and what progress has been there so far?
Zimbabwe has continued to fight for attainment of UHC. The current state of universal health coverage in Zimbabwe reflects both progress and challenges. The country is committed to UHC as in alignment to the global sustainable development goals, with key policies on aimed at improving areas to access to healthcare, with notable achievements including initiatives in maternal and child health.
Yeah.
Ooh, those, though there are significant barriers in our fight to attain universal health coverage, such barriers such as financial constraint,
Yeah.
Zimbabwe constantly falls short of achieving the 15% from the budget declaration with the recent announcement of our national budget. Only I think 10.3% was allocated to healthcare, which is which falls far short of the budget declaration, and it's a continuous hinder because Zimbabwe has never reached the 15% in allocating that to health. There's an inadequate healthcare infrastructure in Zimbabwe with a lot of nurses leaving the country for greener pastures, for example, a lack of professionals to mentor the upcoming generation to take up the fight against health, and disparities in access across the country, to say the least. When the COVID-19 pandemic came, it sort of exposed the vulnerability of our healthcare system, a very hard pill to swallow in terms of attaining a universal health coverage. And this showed that we
Yeah.
need to continue investing in more resilient healthcare systems. And yeah, we do continue advocating for universal health coverage, but I think we also need to continue advocating that our national health budget aligns to at least 15% being invested into the healthcare system there are mechanisms like the sugar tax, all that are going to the healthcare funding, but it's continuously falls short of the 15% Abuja and trying to attain universal health coverage in Zimbabwe. So yeah, I think that's where Zimbabwe is at this current stage. But yeah, we hope we will continue fighting for this. We'll continue fighting for more money for health, and the fight does not end now. Yeah.
We keep going higher, we keep going higher. I think that's even one of the main
Definitely.
reasons why this day is commemorated, so that we try and close those hiccups here and there so that we keep doing better for ourselves. So let's go back to Kenya. Let's go back to Brenda now. So, Brenda, in our populations, we do have vulnerable people. How does UHC strategy prioritize such populations, like the vulnerable people, such as the poor, the women, the children? How does it do that?
Thank you for that question. In fact, the tagline for universal health coverage in Kenya for this whole community health services, it's Afya Nyumbani. So Afya is Swahili word for health, and then Nyumbani is Swahili word for home or something. So it's like we are bringing the health to your homes. And now the good aspect of using the community health promoters, it's like I said, it's people from those communities. So you'll find it's the women who are actually these community health promoters. They undergo the training, they're equipped, they have the mentors who are their supervisors. So this strategy in a way ensures that even the vulnerable populations, the vulnerable people are taken care of. Because if the CHPs are coming from the communities, it means they are aware of the challenges that are specific to that area, the geographical location they're based in. So it's not like we're picking someone from county one and taking them to be CHPs in county two. They're people from within the villages. So it's already a good strategy because since it's someone who knows everyone in that neighborhood, it's easy for them to know that family. I know they struggle with this. I'll go and talk to them about this disease and ensure they seek health care.
Yeah.
That woman is expectant. I need to know, has she started her antenatal clinic visits and something like that. So the fact that the CHPs are from the local communities, it's already a plus in ensuring that these people get access to healthcare. Yeah.
Nice, nice, nice. I love that. I love that. And just still speaking around that, do you think there are certain challenges that Kenya faces when it comes to UHC? Are there any challenges that they face? And if there are, how
Of
do people
course.
manage
Mhm.
to deal with them?
Of course, there's so many challenges, especially in Kenya right now. We have been transitioning into this new insurance system, the national insurance, which came with a lot of heartache for so many people. Because with the transition, people are not able to access services as usual, especially for the chronic illnesses like cancer, diabetes, and everything. So we are facing that challenge. We're still not out of the woods, but it's been a major challenge. There's high out of pocket spending. And from an economic perspective, when people spend so much from their pockets, they're left with so little to even take care of other basic needs. And that affects the general health of a country. When people are not healthy, the economy is not going to be healthy. Then the other challenge that we face, Kenya, like most African countries, we have a high debt burden. Like for Kenya, our debt to GDP ratio is above 50%, and that leaves so little to cater for every sector. Health is not the only sector. So we are all scrambling for this little that is left in the basket. And by the time it
Mm,
gets to health, we don't have that much to take care of the need for the healthcare sector. So those are some of the challenges that we are facing. And we are really trying to find solutions to invite more private sector to join into helping us to take care of our health sector. Of course, the donors are still there, but high donor dependence is also risky because once the donors leave, does it mean we don't have these services anymore? So we are trying as a country to actually push the government to invest more in health, to invest more in ensuring people have access to healthcare. 2030 is so close by, and if we don't do
Yeah,
something right now, we'll probably not achieve our target of UHC. Yeah.
yeah. It's how the answer came with the strength when I asked, are there any challenges? Of course there are challenges. I
Oh,
like that. I like
definitely. We're
that.
Africans. Yeah.
I know we're always facing challenges, but the whole point is for us to identify those challenges and find a way in which we can actually solve them. So,
Mhm.
Josh, just general question. Who do you think is responsible for making sure that everybody in your country accesses healthcare?
Um, health is a basic human right,
Yeah,
which means that the primary entity that's responsible for our healthcare delivery system is our government. And in that's represented through the Ministry of Health and Childcare. Um, the Ministry of Health and Childcare is the one that formulates these health policies, is the one that distributes funds. Well, it has to first receive the funds from the government, but then the focal entity, the focal point in distributing the funds and investing them in what they think is necessary and in what they believe money should be invested to. Local authorities manage community health facilities while healthcare professionals deliver care and advocate for patients. NGOs, they all play a role, and international bodies like the WHO, which are present in Zimbabwe, also contribute by providing additional resources and support. Additionally, communities and families should also take a stance in making sure that they receive the access to healthcare that they deserve.
yeah,
They continue to advocate for themselves. Whilst as NGOs, we also give them, as NGO and CSOs, we should also continue giving them the voice, giving them the vision, making them be seen by the government and governing bodies. So yeah, we all have a part in playing to play in the access to healthcare, but the focal and most responsible body is our Ministry of Health and Childcare. But it doesn't nullify the role that CSOs, NGOs, international bodies, and the individual at the grassroots level. It doesn't nullify the role that they all play in attaining healthcare services for themselves.
the whole time you started, I was just waiting. I was like, I'm waiting for Josh to mention individuals. Because if he doesn't mention individuals, we're going to fight here. Because come on. But I like the fact
Not
that you brought it up.
definitely. No,
Yeah, I like the
definitely.
fact that you brought it up. Because our health is our priority and it starts with us. It starts within us. So what we do is
Yes,
what
yes,
attracts what other people can do. So it's good that you brought that
exactly.
up. You and I will going to fight this platform. Yeah. So, Brenda, let's talk about technology. Yeah. How is technology being used in Kenya to improve healthcare access and the outcomes?
Okay.
How is technology?
Mhm. All right. First of all, I'd love to emphasize that technology is actually so important. It's an
Yeah.
important tool, and I hope more governments will get into technology as a tool. So in Kenya, with the community health promoters, we've said it's the foundation of primary healthcare, and primary
Yeah.
healthcare is our foundation for achieving UHC. So with our
Mhm.
community health promoters, there's this system, it's called the ICHIS system, so electronic community health information system, whereby when these community health promoters get into the households, they key in their details. So they'll take the usual name, age, and indicate whatever issue needs to be sorted. So let's say they've identified a TB patient in this household, they'll indicate that and a referral, because part of what they do, cases like diarrhea, they can easily tell people do this when you're having diarrhea. But some cases
Yeah.
need medical attention at the centers. So let's say someone has TB, they'll indicate a referral case, and this system is linked from the CHPs to the
Yeah.
community health assistants, who are their supervisors, and then to the health facilities. So the nurses have access to this system. So once someone is referred to a clinic, the community health assistant will monitor all the vital signs that have recorded and then approve the referral. So by the time this person gets to the health facility, the facility is already expecting you. So, you feel like an MVP, like these people already know I'm coming,
Exactly.
and they get to know, okay, this is the case we are receiving today. So technology is playing a major role in that, initially they used to store the data using papers, and these are people who are moving around, the community health promoters, so data would be
Yeah.
lost. I know rain can happen, things can happen along the way, but with technology it's so easy for the data to be stored, for monitoring to
Yeah.
happen. It's so easy for the facilities to see, okay, we got 10 referrals today for this case, how many have we handled, how many have come in? And it's so easy to follow up. Some people are so notorious, they'll be told you need to seek health services for, let's say it's TB, but some people don't believe in going to hospitals. So it's easy for the facilities to monitor and say, we were supposed to receive this patient, but they've not come in. What's happening? And then generally, even for the government, the technology is so important for monitoring performance, monitoring service delivery, and planning. And AFNI, during my cohort in AFNI, we had a program for monitoring and evaluation. And the question that was always said, the tagline that was always said, what you can't monitor, you can't plan well. You're just working, but you're not monitoring, you're not tracking your achievements. So it's useful in tracking our achievements and helping us to know, okay, we need to improve in this area and do an improvement in that area. Yeah.
Okay, nice. I like the tagline. I'll stick to the tagline. I'll be using it more often. Yeah. So since we are still on technology, yeah. Josh, how do you think African countries can create a platform for regular knowledge sharing, be it using technology, be it using whatsoever? But how do you think these countries can create a platform for regular knowledge?
Okay, that's a very interesting question. Creating a knowledge sharing platform for universal health coverage among African countries, I think it would involve establishing regional cooperation frameworks, developing things like multi-stakeholder partnerships, using technology, the phones that we have, the laptops that we have, utilizing online platforms, Twitter, well, now known as X, WhatsApp, Facebook. They all play a critical role in implementing learning communities and conducting regular assessments. This
Yeah.
collaborative approach offers significant benefits, including enhanced health outcomes through effective policy implementation, increased efficiency in resource use, strengthened political commitment for UHC advocacy. What else? Yeah, improved capacity building among health professionals and fostering innovation in health solutions tailored to local contexts. By leveraging these strategies, African nations can collectively advance their health systems and address the challenges of achieving universal health coverage. So I think to summarize it all, the points that I've mentioned are some ways that we can use technology or create platforms for Africans to share knowledge. Because if we discover something, it doesn't mean that we have to silo that information from Kenya, from South Africa, from Zambia. We have to be able to share. But sharing, you would have to then create a platform for easy access, easy to share, easy to understand, easy to disseminate. So yeah.
Okay. I think I'll come pick you one of these days because already you're sharing ideas on this platform. So we have to start these platforms ourselves. I'm just kidding. Brenda, what would you like to see in the next 5 years in Kenya regarding UHC? We spoke about what it is, where it is right now, some of the challenges,
Mm-hmm.
but what would you
Yeah.
love to see in the next 5 years?
Okay, so at some point I mentioned that the transition to the new healthcare insurance, which has been quite hectic. So first of all, in the coming year, I expect to see a lot of clarity in terms of how we are transitioning into this new system, because we don't want a situation where we are losing lives just because there's so much happening with the transition to the new system. What I'd also like to see, of course, more investment in healthcare sector. You know, it's still so sad when you get to see people having to sell property, sell their land just to access healthcare. Already that's financial hardship. It's against what UHC is for. So I'd love a situation where the government is actually investing more in health and looking at it as a something that is so important, because like I said, when you invest in health, you have a healthy population, meaning the workforce is now equipped and they're able to work better and boost the economy. And one major factor is one investment of 1 shilling in community health promoters. It has a return of about 9 shillings. So the government needs to see it as a good opportunity to actually invest in health, remunerate those community health promoters because they're doing a good job. And maybe I can just add, despite Kenya, you know, Waki Health is a regional platform. So I'd love to see a situation where there's more integration in the region, because they say diseases know no borders. So Kenya, we can actually equip ourselves, but if a neighboring country is not well equipped, the things will just keep flowing. The diseases will keep on happening and the strain on the healthcare. Then lastly, I'm so happy that this year we had the Summit of the Future, which was a good opportunity for the leaders in the global level, in the regional level, and the whole world to just recommit to the SDG goals, of which one of them is the access to healthcare. So 2030 is so close. So I hope that a lot of progress will be made in the next 5 years. Yeah.
Yeah, we hope so too. We hope so too. We hope that this
Yeah.
progress can, so that we are all really living healthy, because with that UHC is literally leading everybody to live healthy. So if those challenges are worked on, if what we want to see in the next 5 years comes to pass, then we're a very safe society. Yeah.
Yeah.
Okay. So Josh, I feel like I'm really hanging the government on you today, but I'm really gathering the government from you. So I have one last question for you, Josh. How can governments, civil societies, and private sectors work together to achieve UAC? Since you gave us some solutions on the platform, so you can also just try and share how you work together.
I think in order to achieve universal health coverage, collaboration becomes essential. Collaboration between government, civil society, the private sector, and the people. I think it becomes paramount if we're ever going to achieve universal health coverage. Governments are the primary responsible governing body for developing for policy formulation. So without any policies, we can't really speak to addressing any social issue, if that makes sense. Yeah. But in order for government to come up with these policies, to come up with policies that address issues that we face as grassroots members, we CSOs have to do research, NGOs have to do research, engage with the communities. They need to engage with the communities, hear what the community needs, hear what the people need, and offer that to the government and say, you know what, this, and this is what the people need. And then government then debate it out in parliament up to the levels that they deem necessary for that policy to be enacted. And then public-private partnerships are also important because they can improve service delivery and introduce innovative solutions. So yeah, collaboration is because I think every entity plays a significant role in attaining UHC. From the government, from the NGOs, CSOs, private public partnerships, even the people, they play because we're trying to address issues that they are facing on a day-to-day basis. So we are trying to address their needs in essence.
Right.
Capacity building are also aspects that can be used to train people, train professionals, and improve facilities, all of that, all of those aspects. And yeah, in essence, I think, yeah, collaboration is very essential.
Yeah.
Collaboration between, because the government cannot work in a silo. Civil society cannot work in silos. The people cannot work in silos. NGOs cannot work in silos. We need to work together and we need to foster that collaboration and make it easy for each and every entity to play their part in attaining UHC.
Oh, okay. So I think I've been so bad today, We've been talking about UHC, we've been talking about all this, but we haven't really spoken about you people being AFNI mentees. I hope I pronounced that right. Since I can't say the word but by later, so I'll just say that. So what does it mean to be an AFNI mentee? This question goes to both of you. I don't know who's going to take it up first. And how has this experience shaped your approach to advocating for UHC? I think we'll start with Brenda on that one.
Thank you. Thank you so much. So, like I said earlier, this is my first year in the health advocacy space. So I feel like being an AFNI mentee was such a good opportunity for me to actually get equipped. And now I feel like I'm ready for the job. So when it comes to UHC, of course, finances play a major role. We need to ask for more funding and all that. So my background is in economics. So as a health economist, I'm really pushing for more investments in UHC. We have to invest in UHC. Yeah, so being an AFNI mentee cohort, in the AFNI mentee cohort, it meant that I got the opportunity to get the skills, get equipped with the health advocacy skills, get equipped to go out there. And we got opportunities to even learn from people who've been in this space for so long and be mentored by them. So I feel like I'm ready to actually push for investment in health and more health for the money. Yeah.
Nice. I love that. Josh, you have to beat that answer. Otherwise,
I don't think it's possible to beat Brenda's answer. She is an amazing
I'm just
woman.
kidding. Yeah, so the same
Yeah,
question goes to you as well.
I'm very young and I'm very inexperienced in advocacy and fighting for people's rights, fighting for what people deserve. But AFNI gave me a platform to not only address that inexperience, but
Yeah.
provide me with the skills necessary to effectively address any health concerns, any health issue, any social issue that may arise in my area. And not just address, but effectively give people a voice, give
Yeah.
people courage, give people a fighting chance for their rights, to address their issues, to address problems that they face on a day to day. And I think AFNI was an amazing platform. It's unfortunate that it is coming to an end, but it was an amazing opportunity to learn from the best in the field in Africa. I think that Afrocentric approach was also amazing because I was able to learn from leading African health advocates. That way, we have that connection already because we are both children of the soil in that regard. And yeah, I hope that they don't forget me after the mentorship is done. But I would
I
want
hope they are
to be able
listening.
to continue to, yeah, I would want to be able to continue to reach out and learn from the experts in the field. And AFNI gave me that platform to be able to learn and to be able to not only address my inexperience but to grow in my own capacity. So yeah, that's how it has been being an AFNI mentee.
Yeah, that's nice. That's nice. I'm even wishing I was an athlete. Oh my God. But so we have come to the end of our program. But as usual, before we come to the end completely, we love to hear the advice that our guests have for the people out there. So, any last words for the people who are viewing right now, UHC? Anything that you'd want to tell them under 1 minute, just to, yeah. Any last words for the people concerning
Okay.
UHC?
If I can go first, I love that Josh mentioned the responsibility of me as an individual when it comes to health. And now as a HIV prevention advocate. Yeah, so I just want to remind the youth that we have a role in protecting ourselves, in taking care of our health first before we go out there. So yeah, I just want to emphasize the need for us individuals to actually take our health seriously. And when you need to seek healthcare, don't forget to go for it, and don't be scared of seeking healthcare because it's been made available for you. So make sure you actually utilize the available services. Thank you.
Yeah. Thank you so much, Brenda. Josh, any last words under 1 minute to the viewers out there who are catching this live?
Yeah, I think Brenda has said it all, but I'll just add this. The fight is never over until we attain UHC. And yeah, I think that's all I have to add to that.
All right. So thank you so much. We have finally come to the end of our program, to the end of our show. And I would love to say thank you to our guests for just creating time to come here and educate the people out there on UHC and just talk about it generally. You guys give us the best points that we want. And for those people who are catching us live, who are there in the comment sections, thank you so much for being here as we continue the conversations on our Facebook page. But for now, we've come to the end. So bye-bye.